Medicare vs. private health insurance. Medicare and private health insurance are two of the healthcare programs available in Australia. One is the national program and the other consists of private health insurance policies. Australia has one of the best healthcare systems in the world. 8% of the GDP on healthcare, which is less than what's spent by US and UK, but because of a smaller population and also better management, the system is working efficiently. Of late, however, like other countries, Australia too is feeling pressure because of changes in technology, higher expectations of patients and an aging population. Medicare is the universal healthcare system in Australia that takes care of all its citizens. Medicare. Medicare is the national healthcare program in Australia that intends to provide affordable healthcare to its citizens in government hospitals. Medicare was initiated by the federal government in 1984 to provide basic healthcare to all the citizens, especially those belonging to low-income groups. Medicare is implemented through revenues generated by levying one. These funds are utilized to pay for the salaries of doctors, nurses and other staff in government-run hospitals. The remaining funds are utilized in providing drugs and surgery costs incurred in treatment of patients. Despite being a success, there are inherent limitations in Medicare. Private health insurance. As the name implies, private health insurance refers to health policies bought by people from insurance companies to cover the costs of treatment for illnesses and medical emergencies in future. This is over and above the facilities covered under Medicare and provides people with more options while getting treatment for various medical conditions. As facilities in the private sector are considered by people to be better, they opt for private health insurance as Medicare does not allow for treatment by private doctors and hospitals. Private health insurance is encouraged by the government to let more people opt for treatment in private hospitals, and for this very purpose, it provides 30% rebate to people taking private health policies. Anyone who has a private health insurance is eligible for a 30% discount on the cost of treatment in private hospitals.